Thank you for joining us today. So we are here on our fourth out of 5 sessions of our Building Cultural Responsiveness and Mobile Crisis Teams. So today we are going to be discussing the Latino and Latina communities with our subject matter expert. Super excited to have her with us. This series and this presentation is prepared for the M-TAC project, which is funded by DHCS and administered by CARS in collaboration with AHP. The views and opinions expressed in this program are those of the speakers and do not necessarily reflect the views or positions of any of the organizations mentioned. All the material appearing in this presentation, except that directly taken from copyrighted sources, is in the public domain and can be reproduced or copied without permission from DHCS or its authors. Citation is appreciated, and if you are going to reproduce for a fee, please do so with written authorization from the M-TAC project. This presentation is going to be recorded and will live on our M-TAC website for future folks to be able to gain all of the knowledge presented here today. And we also want to do our California land acknowledgement. So we acknowledge that this virtual training is taking place throughout the unceded territory of California, home to nearly 200 tribal nations. And as we begin this event, we acknowledge and honor the original inhabitants of our various regions. A land acknowledgement is a critical step towards working with Native communities to secure meaningful partnership and inclusion in the stewardship and protection of their cultural resources and homelands. So let's take a moment to honor these ancestral grounds that we are collectively gathered upon and support the resilience and strength that all Indigenous people have shown worldwide. So I am coming in from Southern California, and I am in the Serrano area. So just honoring that tribal nation here. So without further ado, we are talking about the cultural responsive crisis care in Latino and Latina communities. Today we have with us Angela Castellanos. She is a managing director with Center for Applied Research Solutions. So super excited to have her join us. So not only is she an amazing presenter and educator, but she's also a pretty awesome person too. So very happy to have her with us. And so without further ado, Angela.
Thank you so much, Erin, for the wonderful introduction. And I want to just kind of say a little bit about what brings me here this morning. And one of the pieces is that this is one of my favorite topics to talk about, not only because I am bicultural, bilingual, I also am an immigrant as well. And so I've been in this country for many years. I won't give my age out, but this is a really great opportunity for me to just kind of talk a little bit about some of the experience and all of the work that I've done in the community with this particular population. And also wanted to just highlight a couple of different pieces that I'm coming in, not only with the experience, personal experience, but also as a clinician working in the community. I did a lot of work in schools with the newcomer population. So I supported and created some projects and programs to support the students and their families within the school systems as well. And I also conducted this amazing mental health conference in El Salvador. And that was actually pretty cool because in El Salvador, there is a shortage of mental health providers. So the wait list could be about maybe 2 to 3 years. And that's if you can actually get to the city to connect to a provider as well. So it was really a beautiful opportunity to engage those students and families to access and training and supporting them in how to access mental health services within their own communities as well. So I come to you with that information and that kind of knowledge, and wanted to also just kind of thank you this morning for joining me in the conversations as well. And so as we start and embark this beautiful morning of Thursday, we're going to talk about a few things. One is that we're going to go through some of the cultural identity and behavioral health needs to recognition of the key cultural factors. And why that's important for us as mobile crisis responders is that we want to be able to understand the core values, historical influences, and also socioeconomic factors that shape the experiences, because what we know is that cultural identity is deeply tied to behavioral health. right? So that really influences how individuals are going to perceive and respond to us whenever we're, showing up in their homes, in the community as well. And also talking a little bit about how these migration history, acculturation, stress, and intergenerational trauma all also play a role in shaping the mental health experiences for our communities. And some of these pieces that we're going to review today is the key cultural factors that we're going to address, because there also were a lot of joys within the particular community. And that is included in these key cultural factors. That includes familismo, respeto, personalismo, and also these pieces also influence how they seek behaviors as well. Increasing help-seeking behaviors as well. We're also going to go through some of the historical influences that impact some of the work that we do, such as systemic inequities, immigration experiences, and also community trauma, which also can impact some of that trust, right? So we're going to talk through how to connect and eliminate some of those barriers so that we're able to develop that trust within the community also. And then we're also going to talk a little bit about some of those socioeconomic factors that can contribute to mental health disparities as well within the population or the community also. And what we know is that despite these obstacles, which include mental health stigma, language barriers that we're going to address as well, and some of the legal concerns and generational differences are also going to be addressed today as well. And then we're going to wrap this around in applying some of these approaches to a case that we're going to go through partly at the middle of the particular presentation today. So I'm very excited to share this information with you. So this is going to be, again, our journey for this morning as we talk about some of the pieces that I already mentioned. But how we're going to go through this process is that I'm going to provide some context. Erin and I are going to have a beautiful conversation with you about some of the unique needs, right? We're also going to highlight all of these pieces that are faced by Latino individuals and their families, particularly when we're accessing mental health care and the crisis support. And then we're going to talk through some strategies and advocacy support. And we're going to sprinkle some of these strategies within the presentation as well. And again, like I said, we're going to have this beautiful kind of close out with a case scenario that we're going to practice and kind of go through that experience as well. All right, so now we know who we are. I got a little bit of introduction about who's in the space today. And so before we get started, one of the pieces that I wanted to just get us grounded and connected to the work that we're doing this morning is I'm going to have an invitation for you. Okay, we're going to start to kind of think about our culturally responsive care for the Latina community. And the invitation is for you to share maybe one word or a short phrase that comes to mind when you think about culturally responsive care means for the Latina community. It could be a value, a feeling, a principle. So I'm going to start it off and I'm going to put in respect, right? That's one of the pieces that comes to mind for me as I do the work within the Latina community. So I'm going to give you about a minute or so to just join and share your thoughts. Is everybody able to have access to that Mentimeter there? All right, I'm going to start seeing a word cloud pop up right now. So as you're seeing these words pop up, are there any common themes that stand out to you? Right, so I'm seeing values, honor, integrity, compassion, sensitivity, family, tradition. Okay, I see somebody in the chat wrote in dignity, seen and heard, cultural respect, strength, unified, integrity. You said compassion, I think. That one seems to be like popping up most consistently, right? That's the theme that we're seeing here. As you start to think about these words, again, they're going to be sprinkled throughout the presentation this morning. And you're going to, the invitation is to continue thinking about these words as they come to mind when we're having a discussion this morning as well. All right, so what we know is that Latina communities are extremely diverse, right? They're encompassing various cultures and traditions and experiences. They're in that word cloud, and we know that they make up a significant portion of the US population and contribute richly to society through their work, values, and cultural heritage. However, despite these strengths, there are some systemic barriers that we're going to address in just a second. That also limit the healthcare and crisis support services. So it's really important for us to understand these challenges, because this is a way for us to improve some of the work that we're doing and also connecting to the community when crisis situations arise as well. Before we dive a little deeper, wanted to take a little bit of a moment to talk about language and identity before we kind of get through. And so, as you know, you may hear different terms used to describe people of Latin American descent. And these are in front of you on the screen. These are just some of the many. And some of the pieces that you've heard is like Hispanic, Latino, Latina, Chicano, Chicana. And these are just 3 examples of the many terms that are in use. And it's important to recognize that Latino identity is very complex, right? These terms can mean different things to different people. And they're often shaped by history, geography, culture, personal experience. And so as you look at the word Hispanic, this particular word or identity refers to people from Spanish-speaking countries, typically emphasizing language. Latino, Latina, or Latinx or Latin A refers to people from Latin America, including Brazil, and centers pretty much on geography more than language. Chicano Chicana is a political and cultural identity often used by Mexican Americans, especially those with roots in the US and civil rights movement. And so these terms fall under what's known as panethnicity, a broad label that groups together people from diverse nations and cultures under one umbrella term, right? So it's important for us to recognize these pieces. And while panethnic labels can be helpful in some contexts, they can also oversimplify or erase individual regional identities. And so here the piece is the goal is to not to choose the right term, but just to be aware, be respectful and curious about how people identify, and to center self-identification whenever possible as well. And so gender neutral is also very acceptable as well. And for today's presentation or this morning, we're going to refer to the entire presentation, use Latino and Latina identity for the purposes of today's presentation. So, all right, so let's talk a little bit about looking at some of the population and migration trends. So we're going to go through identity, who the community is, and then we're going to get right into some of the needs and joys of the community. And so as we begin to look at some of the key population and migration trends that are shaping Latin America and the Caribbean, we have seen that there's a population growth in the region. It's slowing down a bit due to aging population, but we're also seeing a surge in urbanization driven by rural to urban migration as people are seeking jobs, services, and infrastructure. We're also seeing that more than 25 million Latin American migrants live in North America. We're going to get into some of these pieces more specifically in the next couple of slides. So as we're looking at migration trends, there has been a significant uptick in reverse migration. And what that means is that where individuals return to or sent back to their countries of origin. And this is particularly affecting Venezuelans due to a part of changing of US immigration policies. We're also seeing that Venezuela and Nicaragua also continue to experience internal displacement because of political and economic crisis that are pushing people out of the country to flee to America. And meanwhile, countries like Costa Rica are also adapting by issuing temporary humanitarian permits to deported immigrants. And as we're looking at very much more specific, we're going to hone down in some of the areas that we're seeing in the trends. In Venezuela, we're seeing that over 7.7 million people have fled due to ongoing crisis conditions. And then Nicaragua continues to see rising migration as a result of political instability. While in Peru, Brazil, and Colombia, migration to the US remains pretty steady, largely driven by the pursuit of economic opportunity, right? So there's a piece of commonality that we're going to go through in later on this morning But what this basically tells us is that there's an underscore of dynamic and evolving nature of migration across the region. And this is really important for us to recognize, and the need for culturally responsive work or informed responses in our work, right? So we're looking at some of these pieces as well.
Yeah, and I think it's also important to point out that as we're working with people who are coming, who maybe first or second generation, they have this trauma
Yes.
from their native country, from where they're coming from. So experiencing that trauma, and imagine if you uprooted your family and went to somewhere where you don't know anyone there, and how scary that is, and how desperate you have to be in order to make that transition. So this is kind of like the mindset of the folks that it was so awful where they were coming from. So just having that trauma-informed lens and that person-centered lens of being able to understand that they had a lot happen, either to themselves or to their parents or grandparents' generation. So we
Yeah,
may be dealing with generational trauma as well.
absolutely. Thank you for pointing that out. We're going to talk a little bit about that triple trauma that a lot of folks coming to the US experience. And also, like you mentioned, Aaron, the intergenerational trauma is also another aspect that we're going to address. But thank you for that insight as well. And so as we're looking more specifically California based, right? So the other aspect about the migration is that in 2022 and 2023, Hispanics accounted for nearly about 71% of the total population growth in the United States. So that's an increase of approximately about 1.16 million individuals, which represents a 1.8 growth rate in just 1 year. That was just 1 year that we're noting this as well. And so this speaks volume as the vitality and expanding presence of this community nationwide, right? So we're seeing that spread throughout the migration throughout the US, but we're going to zone into California a little bit more. And California continues to be the state with the largest Hispanic population in the country, which is home to about 15.6 million individuals. And this is also another piece that Aaron was mentioning, that it's important how the implications about the way that we approach the work and services and outreach and community engagement needs to be very tailored. And we're going to talk a little bit about that in just a second. But the other piece too, it's not just about the size, right? So we're seeing that 71% of the total population growth, but we're also noting that 45 million Latinos in the US are under the age of 44, which is really highlighting a young and vibrant demographic, which has an implication for us with education, workforce development, behavioral health, and also long-term service planning. And so for mobile crisis responders, understanding these numbers help us to align our services with the cultural and generational realities of the communities that we serve, right? So we're seeing an uptick in that population, but also the age is going to be an important factor for us to recognize as well. The slide is an eye test because it has very tiny little font, but if you're able to read it, this is a really nice chart because it really illustrates the population breakdown in the state. And so I'm going to give you about a minute or so, like maybe 30 seconds, so you can glance at what this chart is really telling us, right? So what is it really letting us know is the population growth in the different states. And so the noticings for me that I see is that we have California cities that are highlighted here, right? So there's a steady growth in these areas. So we're seeing Riverside, San Bernardino, Ontario has the third largest population growth. We're also seeing Sacramento, Roseville, and Folsom, and also Fresno, California is also on the list as well. So these shifts are important because they also can impact the demand for mental health services, crisis response needs, and also community outreach efforts as well. Feel free to put in the chat any other noticings that you identify here in this particular chart as well. And what we also know is that we want to be mindful of the language access, cultural responsiveness, and also regional differences that we're noticing as well. I'm going to pause a minute because it's a lot of numbers, right? It's a lot to think about, some of the pieces, the way that we're approaching the work. More statistics, but this is a really important one as well. So we know the numbers are increasing, but One of the pieces that I thought when I was doing some of the research as well is, so this particular slide really impacted me because it says here that 31% of Californians ages 18 to 64 speak Spanish only. It's a large number, right? The other pause is that in the limit of English proficiency among California residents between that particular age population or age range, 18 to 64, about 39.3 report speaking English less than very well. So this really just highlights another piece about the way that we're delivering our work, right? So later we'll talk about this again, but the Spanish speaking through, or either providing responders that are speaking the language, right? So bilingual responders, or through interpreters, or using utilizing like language lines as well. It's going to be something that's we have to get creative about the way that we're communicating. I know for me, a lot of the families that I work with, they prefer to work with someone within, the natural language. But sometimes the resources are very limited. So we'll talk a little bit about those pieces as well. Okay, take a pause there because that was a lot of information with statistics and getting to know the community. But now that we have a better understanding of the population growth and the data trends, we're going to shift our focus to the values and strengths. And this is what I call the joys of the community, right? So we know that we talked a little bit earlier about how much cultural values that they bring to the US population, but also it's really important for us as mobile crisis responders to recognize these factors because they can serve as tools for the way that we promote healing, resiliency, and well-being, and also really connecting with the families that we're working with on a day-to-day basis. All right, so I love this colorful flag. It just reminds me of like just excitement, colorful. And what we know is that within the Latino, Latina communities, we are deeply rooted in family. In the word cloud, you mentioned this as well, faith, right? Collective support systems are also something that's identified as well. And they all can be a beautiful, powerful buffer in the time of crisis, right? So by understanding these strengths, we can actually develop culturally appropriate approaches that build the trust, right? That connection with the family that we're working with or the individual, and also enhance our mental health outcomes as well. So let's talk a little bit more in detail with these particular cultural values here as well. So we're going to start off with familismo. And in many, like we mentioned earlier, in many Latino families, family central to identity, decision-making, and daily life. We know that this is a strong value because it's often described, like I said, the concept of familismo, which emphasizes loyalty, closeness, and prioritizing family needs over individual needs. And this is not just about the nuclear family. Oftentimes when you're going into homes, you're going to see multi-generational families living in one household, right? So this extends to grandparents, aunts and uncles and cousins, and even close family friends, right? So the neighborhood is another aspect of this familismo value that's really prominent within the Latino community. And so when we're thinking about this particular aspect as well, we know that extended families, they often activate support systems, right? So I mentioned earlier, multi-generational households are common, reflecting deep-rooted values of togetherness and shared responsibility. And again, the other piece too is that I mentioned this bit earlier in our word cloud as well. And it's also deeply held cultural value, especially towards the elders and authority figures. And approaching families with cultural humility, which you do anyway, but this is another aspect that's going to help to connect with the families that you work with on a day-to-day basis. Cultural humility, warmth, and difference builds trust and encourages openness during these crisis situations as well. And so when we look at familismo, it also helps us as mobile crisis responders to be clinically informed, but also be clinically attuned and community-centered, right? So when we're going into the community or to the homes, we're understanding that family is going to be a huge role within our connection to the individual that's in crisis at the time. And it's also being able to be mindful and be dynamic and connecting to the families in that space. Another one is spirituality, right? So oftentimes I know with the families I work with, a lot of these spiritual beliefs were really prominent in the household, right? So it plays a meaningful role in the lives of the community, especially during the times of crisis, right? So spiritual beliefs are often, they provide a sense of hope, meaning, and guidance, helping individuals navigate through their hardships or resilience and purpose. And every time I would talk to the families, they would say, si Dios quiere, right? So just kind of really connecting to spirituality and hope was really something that was connected to the families that I work with. And a lot of times, many, like I said, many turn to prayer, religious leaders, and faith-based communities, right? So a lot of times they may not go to a mental health provider. That's not their initial, like, first line of contact. It could be their priest or their pastor, right? Somebody that they connect with immediately, second to a mental health provider, or even third, right? Because sometimes they connect with family members first before they even reach out to mental health or behavioral health providers as well. And so it's important for us to understand, because this is another piece about connecting to, when we're doing plans and connecting them to various resources that they're used to connecting to, something that's going to be another important aspect of the crisis work that we do. But it also, it's another tool or strategy to provide comfort and strength, and also connecting to healing, right? That's another practice that's also utilized as well. Another piece is that spiritual and traditional healing practice are often used or connected to within the families. And we're looking at spiritual and traditional healing practices such as curanderismo. It's often seen, which is curanderismo is a blend of indigenous, African, and Catholic traditions. And often these practices can include like herbal remedies, ritual, spiritual guidance that contribute to holistic well-being mentally, emotionally, and physically as well. And this is one of the things that kind of this reminds me as well, is that there's also a connection whenever there's grieving that's taking place. It's spirituality is a big component of this aspect as well. The other piece, the last point with the ancestral connections on this particular slide, is just as equally as important. It holds a strong presence in the Latina communities, because they're also expressed through like different practices, beliefs, and they're also passed down from generations. You know, the beliefs, even from not just the beliefs, but also cooking or different strategies or interventions that they're using throughout their generations is passed on to the next generation as well. And what this really signifies is that it provides a strong sense of belonging, identity, and then cultural continuity is really, really important as well. And it also is another big connection to serve in times of adversity. This is when this kind of kicks in a sense as well. And so when we're thinking about crisis work, one of the pieces that I think about too is important to understand these spiritual, ancestral, and traditional frameworks, because it allows us to build that deeper connection. And like I said earlier, it can also help us to build more of a plan to support the family, the individual, once, you know, the crisis has been de-escalated. So it's another really important aspect of this information here. The next cultural value is cultural is the community, personalismo, strong social bonds, right? So I talked about it earlier, where neighbors, friends, and community groups can function as natural support systems as well. And this concept is really about providing that warm and personal interaction. It helps to build that rapport. I remember when I used to do home visits, a lot of my families would cook for me. And that I'm like, oh, you don't have to cook for me, it's okay. But this is their way of like just respecting the work, and so, you know, being appreciative, like, because they couldn't provide anything else. And so I sometimes I would have the meals and sometimes I wouldn't, but I was just, no, don't go out of your way to cook a meal. But they would cook this fabulous meal just to, you know, provide that warm community connection or appreciation, right? And so it really helped to build that rapport with the families. But also, The other piece too is that using this can be connected to mutual aid and collective problem solving. That's another aspect too, because they're also going to be connecting to their family, whoever their support system. This is a really great opportunity for us to also utilize this as a plan or a strategy to be able to support the family, because they're going to have some additional support systems that are available as well. And this also reminds me too that in another project where we have promotoras, and they support each other in a way that's like so engaging and so community based, that it's really neat to see that collective problem solving. So they'll connect to their peers, their families, their neighbors, and this is a really great opportunity to connect that, because one of the pieces is when you're thinking about the planning is that you're going to ask questions about the trusted community leaders, organizations that they traditionally connect to. And so that's going to be another way to provide some strategies or support to the family or the individual in crisis.
Yeah, and I think, Angela, as we're talking about the cultural strengths of the Latino community, like as we're looking at person-centered care, we want to bring in those strengths to support us on maybe the safety planning or connecting back to their community for when they're in crisis. Those are the people, the community around them that's really going to support them during this crisis. So sometimes, when I've worked with some of the younger kids, sometimes they just need a break from their parents. Sometimes there's just like a lot of toxicity going on, or there's some arguing. So asking, can this youth go to Thea's house or Theo's house or somewhere else? And so having that community bond and that extended family that's very much seen as primary family too, having that support there can really help youth when they're going through some challenges, to be with a trusted person that the family trusts, but it allows them this space. And then with the spirituality too, I've been on calls where, looking at the faith of the family, they would say that they're going to bring in the priest to the family to pray over the house, to say the rosary, to do some holy water on the home. And so all of that is part of our safety planning too, and part of bringing community and culture into our crisis work. So it's utilizing all of those strengths of the cultural identity and community to bring it as a support and bring it as safety planning too. So
I love that, Erin. Yeah, no, thank you for sharing that. I love that, because I think one of the pieces about the strengths is really for us to leverage these strengths as we're thinking about the planning, right? So part of it, like what you're talking about, is really incorporating the family, their faith and community into the crisis intervention strategies, right? So as you're building on those pieces, it's important for us to leverage those aspects, but also recognizing these strengths is also going to support to reduce that stigma and foster that engagement, right? Because we were saying, Erin, hey, if the kiddo needs to be connected to another, needs a break, right? So we're going to foster that support, and the family is more likely to be engaged in the treatment and the support for the young adult that's in crisis at the moment as well. And this is also where we're going to be creative with our work, right? So it's tailoring these interventions that are family-centered, right? Collaborating with the faith leaders that you're mentioning, and also integrating the community-based resources can also lead to better outcomes, right? So they're more likely to engage to services if we're collaborating or engaging or leveraging these strengths, as you're mentioning.
Absolutely.
Mm-hmm. All right, so now that we talked a little bit about some of the joys within the community, I'm sure there's many others and that you can think of as well. We're going to shift a little bit to talk about some of the needs within the particular community. And so as we're shifting that, we're going to go back to some of the strengths as well, but understanding the challenge is going to also help us better understand and tailor our interventions and strategies as we're approaching the support to the community or the individual in crisis as well. And so as we're thinking about those joys or exploring some of those protective factors, we know that there's going to be challenges that many Latinos community face, right? So it's really important for us to understand them. And so the first piece that we're going to talk about is the systemic barriers to healthcare. So remember the slide about the language, right? So there's a high number of Spanish-speaking individuals in the state of California. So we know there's going to be language differences, right? And there might be also lack of insurance is another aspect that we have to consider as well. And we also, the reality as well is there's not only is there a limited number of providers in the state of California, but also like culturally competent, right? So the bilingual providers are also, there's a limit of access to that particular resource. The other piece too, this is going to be a piece for us to understand that it can create mistrust in systems, right? So including crisis care, right? So one of the pieces that you do this on a daily basis anyway, but an additional reminder that we must be prepared to meet individuals with empathy so that we can bridge and trust and bridge that gap, right? So understanding that there's going to be a language barrier, or there could be potentially a language barrier, or language insurance, right? Some of these pieces can become a barrier for us to access that individual. The other challenge as well is that there's immigration-related stress, right? So we talked about some of those pieces that current policies or current individuals from certain countries are experiencing right now. But this is in general that there's a lot of immigration-related stress, which is another factor as well. And so what we know is that there's a lot of fear of law enforcement, deportation, and also family separation can cause individuals to engage with crisis systems, right? So there's that distress that's happening. And so as responders, one of the pieces for us to keep in mind is that we want to, again, just a reminder to approach the situation with reassurance and transparency and cultural sensitivity, right? So being able to connect with the families and letting them know what your role is and your purpose for the connection is very important. Another aspect as well, or challenge, is mental health stigma. One of the pieces that we talked about in the spiritual aspect is that a lot of times they could be tied to cultural beliefs or the fear of being labeled, right? So this is one of the important pieces that we have to consider, because that can also prevent somebody from accepting the help, right? So being judged or labeled, yo no soy loco or loca, could be something that's something that we have to acknowledge as well. So again, just using respectful, non-judgmental language is important, and explaining the services can clearly reduce that stigma and ensuring that connection with the family as well. The other consideration is that sometimes the mental health concerns or the presentations, such as anxiety, depression, and trauma-related symptoms, they may not always be described in clinical terms. And so we have being aware of the cultural idioms and how some of these pieces can come across is also very important, right? Because a lot of times within the Latina community, it is psychosomaticized, right? So they'll often refrain to like, oh, my head hurts, or my stomach it hurts. So it's a lot of it is psychosomatic, and so they may not be presenting the way that we traditionally, come across with the particular presentations as well. So it's really important for us to understand how the distress is expressed, and whether it's physically, emotionally, or physically, or even spiritually, right? We want to be able to make sure that we're validating those experiences as well. And I talked about this earlier also, that the impact of grief can also, grief and loss can also be something that's expressed in a different way. But also there's grief and loss connected to not just death, migration, but also the disconnect from culture. And this is kind of referring to what Erin was mentioning earlier about the triple trauma. The reason why they were leaving their country of origin, the migration to the United States can be very traumatic. And also the third component is being in a country that's different, right? So they have to adjust to a lot of different pieces. That's another aspect that they're actually navigating. So it's sometimes all these pieces are unspoken and can be very layered. I'm going to pause, can be very layered. I'll just say it again, can be very layered, right? Because there's a lot of components that are happening there. So sometimes the pain can be unspoken. And then also Erin talked about this earlier as well in generational trauma. This also helps us to understand and not misinterpret some of the behaviors or their reactions, and just recognizing that there could be historical and family level trauma can guide us to be more compassionate, clinically attuned, and providing that supportive response as well. A lot of these situations are very complex, and so it helps us to understand these pieces because we can be more effective when de-escalating, building that trust. And then also, like, again, this is almost going to be like a connection, right? That we're going to be able to help to link individuals and families to supportive services. So that's going to be a really important aspect as well. Anything else you wanted to add on this, Erin?
No, I think I just wanted to kind of reiterate a lot of what you were saying is, it's just all the different layers of trauma, the different layers of grief, and it's experienced for years. So someone could still be mourning the loss of someone 30 years later just as strongly as it was. And I felt like I had something else in my head, but it left. So we'll just leave it at that.
Yeah, it'll come. Yeah, I know that's a really important aspect. And so in the work that I did in El Salvador, one of the pieces that was really important to highlight is that a lot of the families, like when the team that I went with, they didn't want me to say the word trauma or depression or all these clinical words because they were afraid of how they were going to respond. But I just want to put language and connecting to the pieces. But the families were so open to talk about this, but what you just said, Erin, about the multi-generational pieces, never spoken about, right? I wish I would have been there for for longer than 3 days, but they had we had multiple conversations. It was such a beautiful, dynamic to see where the families were like, no, we really want to talk about this, right?
Yeah, and I think the other part I was going to say is, being a crisis responder, there were numerous times that I was called out to like a primary care physician's office. Because as you said, someone's going in with a stomach ache, someone's going in with a headache, someone's going in with their physical ailments. And then when they start asking about grief or trauma or mental health or any of those other things, all of the connections, all of the somatic experiences are now being attributed to the mental health. And so there were numerous times where I was called out to medical offices, and it was the somatic experiencing of all of that grief and trauma.
And so one of the pieces we're going to dive a little deeper into is the immigration related stress, right? So I'm not going to go too much into detail about the triple trauma that we talked about earlier, but one of the pieces that we often see is that there's very specific stressors and trauma experiences that are often faced within this aspect here. And especially right now, I think, well, it's been a process, but even currently, there's a lot of immigration related stress, and individuals are constantly thinking about the uncertainty about their legal status and the potential for deportation, right? So that adds on to the mental health challenge, and then coupled with the separation from their family. So thinking about deportation, and also there may be situations or political reasons why they fled their country of origin. So now they're also even adding more stress to thinking that they have to go back to the country of origin. So there's a complex process that they're experiencing at the moment, right? So the fear of deportation, the separation is pronounced. And not only it interrupts the families, but also leads to a lot of anxiety, emotional distress. And also, like Erin and I were talking about, that it can manifest in different ways, from depression to severe, trauma aspects as well. Another aspect that we talked about is the acculturation difficulties, right? So as part of that triple trauma, once they get to the United States, they have to adapt to a new culture, trying to hold on to their own cultural identity. And then oftentimes this can lead to isolation, confusion, or even guilt as well. And so they're balancing between two cultures, particularly facing societal expectations, and also can be very mentally and emotionally taxing as well. And again, just experiencing or acknowledging the triple trauma experience. And, like we mentioned earlier, it occurs in 3 stages, right? So again, just the migration, the leaving, the reason why they left their country of origin, the migration itself, and then also being in a new country can often leads to a lot of stress, especially in situations where it can be hostile or unwelcoming. And these can actually have a long-lasting effect as well. It's really important for us to acknowledge some of these pieces. And one of the other aspects that we talked a little bit about is the mental health stigma. And one of the pieces that, as we deepen our understanding of the barriers and how the impact, particularly with mental health access and engagement, it's also important for us to recognize that there may be some limited access to services, and that could be a structural challenge, right? So you notice in the map, and not the map, but the chart of the different cities, there's an increase of communities or migration in this particular communities. We know that there might be underserved, or there might be limited resources in those areas. There might be culturally and linguistically appropriate services may not be available in those communities. So those are the pieces that could also contribute to that mental health stigma, because they cannot get access to that as well. And also the mistrust of in mental health systems as well, which kind of touched on earlier, including that discrimination, the lack of representation, and stigma can also impact the way that they access services as well. Cultural values such as modernismo and machismo can also influence the way that we perceive mental health as well. They may not feel empowered or safe to access the services that they are looking for. And these gender norms often shape the way that we are providing the care, right? So it's really being, informed about this information. How we approach individuals is another aspect that we're going to talk about with our case scenario. And also generational differences, right? So Erin talked about some of the pieces that can come across, for example, in younger generations, they may be more open to mental health services rather than the older generation as well. So that's another aspect for us to consider, that they may just be hesitant because they just haven't been used to having that kind of support available if you're responding to somebody that's older as well. Language barriers is another major obstacle, not just in the translation, but also connecting to a provider that understands the nuances of the language and culture. And like I said earlier, sometimes the way they're manifesting some of the clinical pieces, they may not be expressing it the way we traditionally hear often. So we talked about that as well. And then also the last piece is that cultural expectations about emotional expressions also play a big role as well. And there's a big aspect around it, kind of connects a little bit to modernismo and machismo, but maintaining emotional control and keeping personal struggles private is something that's also a big component that we want to acknowledge or recognize as well. And so when you express your feelings of sadness, anxiety, or depression, it may be something that they want to avoid, especially in front of family members, right? So that's another aspect that we want to make sure that we're validating and recognizing, and also can create an added layer of complexity when it comes to recognizing mental health needs and seeking help, right? So those are some of the aspects around mental health stigma and how we approach and how we connect to individuals. And these are some of the common mental health concerns, and we started to talk a little bit about them. And one of the pieces that we're looking at is depression is a prevalent issue, and they can include persistent feelings of sadness, hopelessness, and changes of sleep or appetite. But often it goes underaddressed because of the cultural stigma surrounding mental health. So we talked about some of that as well. And some of the contributing factors can be acculturation, financial stability, family pressures, and constant fear of deportation or loved ones, right? So that's the way that it can be manifested as well. Anxiety is another common mental health challenge that we're seeing, but also, again, reminding us that it can be exhibited in different forms, which is more psychosomatic versus like the traditional way that it's expressed as well. And these anxieties, again, can be expanded because of the immigration status. Difficulty navigating unfamiliar systems is another aspect also. And we also talked about this as well. Post-traumatic stress disorder is another significant concern. We talked about the triple trauma, but also, part of it too is that they're maybe have experienced such violence and abuse in the conditions within their country of origin, and often develop some sort of PTSD or post-traumatic stress. And that includes having flashbacks, nightmares, and emotional numbness or hypervigilance as well. But the trauma from the migration experience can also have a lasting emotional distress as well. And we talked about that in the triple trauma experience as well. Intergenerational stress is another aspect that we are also considering. And for many families, the children absorb unspoken fear, sacrifices, survival strategies of their parents. Oftentimes, you reminded me of, like, a lot of times when I work with youth, they often say, I don't want to worry my family. Like, I don't want to talk about whatever I'm experiencing because I don't want to, get my mom sick again, right? So
Yeah, I have heard that many times. I don't want to talk about this at home because I'm scared that my mom will have a heart attack. And so it goes back again to the somatic, but then also just really that holding it in and not having like that space to speak with family.
Yeah, and then it leads to chronic stress, right? So that's another aspect that you're kind of the psychosomatic, and that's kind of like almost that loop, right, that they're experiencing. So it's really important for us to acknowledge some of these pieces or recognize that it also might present as physical exhaustion, irritability, or difficulty concentrating, right? So those are the ways that they're expressing some of their mental health concerns that can come up for them also. Okay, so as we continue our discussion, one of the aspects that we're going to talk about now is how do we integrate some of these pieces into the work that we're doing. We started to sprinkle a little bit into our work, but now we're going to dive into having that conversation around how do we provide the support, understanding the unique needs that Latino communities face, right? And so how these pieces kind of manifest into the work that we do on a daily basis. And so the first point here is crisis can manifest in Latino communities through fear of authority and reluctance to seek help. And one of the aspects that we want to make sure that we think about also is that because of the undocumented status or mixed status families, they may hesitate to call for help due to concerns about law enforcement, involvement, or potential immigration consequences. And so again, we're often seeing that they're reluctant to seek help because of these pieces, right? So one of the aspects to overcome these barriers is that trust building is going to be very, very crucial as we're connecting to families. And so by establishing that rapport in a cultural sensitive way, for example, like acknowledging fears, validating the emotions, ensuring individuals feel heard and respected, it's going to be something that is highly recommended for that connection with the family, right? So when we're approaching a family with humility and respect, we want to make sure that we're taking the time to listen and understand their experiences rather than immediately directing the conversation toward services, right? So because I know we're time limited sometimes, or there's different pieces going on, but it's important for us to approach the conversation with the humility and the respect for the families as well. The other piece that we talked about is explaining the roles very clearly, right? Many assume crisis responders work alongside with law enforcement. We're not gonna recommend that piece because we want to make sure that we're clarifying the role as a supportive mental health focused service, right? So I saw you unmute yourself, Erin. I don't know if you wanted to chime in here.
Yeah, you're going right where I was going to chime in
Okay.
at, but I could just really add and emphasize that, having a government car arrive to someone's home, if your mobile crisis vehicles are labeled with the county or with the agency that you're with, some mobile crisis vehicles are caged. Think about what that experience is for that family coming in. So, one of the things that we spoke about in one of the other cultural trainings is really emphasizing that it's none of our business what somebody's legal status is. We don't care what their legal status is. And so maybe but having a government agency come in could be terrifying for them. And having that opportunity to build trust may not even be there if they're so fearful, if they're scared that their family's going to be ripped apart, that we're going to take somebody away. So I think, your community's best. So leading with that, leading with, I don't care what your immigration status is or whatever you feel is appropriate, but we're here to serve, we're here to help, and that's it. So if we can take that fear away, let's take that fear away so we can engage with the human that is in front of us. But yeah, just acknowledging how that would feel to have, especially we've all been seeing the news with what's been going on, having a government agency pull up to their house, how terrifying that would be for them. So just acknowledging all of that.
Yeah, thank you, Erin. He also touched on to this also is the normalizing that seeking help is good, that you're there to reassure that you're not there to again, the immigration pieces or that needing support is not a sign of weakness, but just a step forward towards healing, right? So you're there to connect them to their healing experience. So I think that's important for us to acknowledge also. Some of the practical strategies as well is that as much as possible, I know that sometimes it could be limited, right? We're using bilingual crisis teams. It's also very important to do whenever possible, right? If that's not possible, making sure that we have interpreters that can also ease that communication barriers as well. And that really helps to make the individuals feel more comfortable, but also they can express themselves more comfortably, but also better, right? So they're able to express whatever they're feeling or their whatever their stress is that they're experiencing at the moment. They're able to express that in a better way, because a lot of times, like we mentioned earlier, that the mental health or the clinical pieces may not be directly translated, and so those are the things that we want to be important for us to hear and listen to very clearly. So as much as possible, being able to use bilingual crisis teams, but if you can't, then interpreters, or having language that's accessible to the families or the individuals, going to be super important as well.
And even interpreters who are trained, so not using kids, not using family members. So making sure that you have trained in interpreters who are able to, really communicate what you're saying. So and I know all of you guys know this, but just wanted to reiterate that it's just not appropriate to use children or family members.
Well, thank you for acknowledging that, because that's another aspect of the stress as well. So if the child may need, maybe if they're using their children as interpreters, the child may also benefit from support. They may also be reluctant to seek services because of that dynamic there. So it's really important to not use the children as interpreters also. So that's really important as well. And the other piece too that I wanted to remind is the acknowledging of the role of the family and faith leaders and community organizations in the work that we do. Again, the more connected that we are to the community that we work in, they're more likely to seek those support services, right? So when we're asking them, like, if they belong to any community organization or faith-based organization, that can also be a really nice way for them to connect to additional supports that are available also as well. So. All right. Additional pieces, we talked about this as well, which is avoiding the law enforcement, right? So just to reiterating that this can be the presence of law enforcement, again, can increase the fear, escalate more distress, and also have negative experiences with authorities. So these are the pieces, just to kind of reminder again. And the clearly communicate what your role is, again, with that as well. Lead with compassion and empathy. That's something that you do on a daily basis, right? But just a reminder that what the role here, or one of the pieces, is to help the individual feel understood and supported. And by understanding some of the cultural aspects, this is going to get to you to connect with them in a different level as well. And also, again, approaching with non-judgmental listening and gentle reassurance is going to be another important aspect also. I'm going to pause and go to the chat. Somebody mentioned that they had a call once where language line gave up, said the client had a rare accent and couldn't understand, but my partner immediately said that's not an accent. He's lost his dentures. So other aspects that are really important. So good for connecting that information as well. The other aspect, again, is using family and safety planning. That's appropriate. You know, we want to make sure that we get permission from the individual, but this is another aspect to incorporate in the work that we do, is providing that support or utilizing the additional support systems that are available for the family as well, including that to develop that safety aspect. So the other piece that we talked about as well earlier is the respeto, right? So the respect of the authority of like the elderly or older individuals, and addressing individuals with respect. You know, sometimes they want to say señor or señora within the process of connecting with the individual as well. What are the other aspects? Anything else you want to add into this, Erin?
Let's say, I think a lot of it is just, like bottom line, treating people like people. So, and leading with empathy and compassion, absolutely. Being present, giving them time and space. Because even sometimes the communication patterns can be different from culture to a culture. So sometimes it takes a little bit longer for one culture or another to kind of get to the meat of the story. And so just allowing that space for them to tell their story in their way.
Okay, so now we're going to connect all of this that we just talked about into our case scenario. So I want you to meet Carlos, and I'm going to just read this pretty quickly. But one of the pieces that the invitation is to what we've talked about when it comes to language, identity, all this needs and joys of the Latina community. How do we incorporate some of those aspects into Carlos's support in the work that we're doing with Carlos? And Carlos is a 35-year-old Latino male who recently immigrated from Honduras. He lives with his wife and 2 young children in an urban neighborhood. Since arriving to the US, he has experienced worsening anxiety, depression, and overwhelming stress. And recently, he has become socially withdrawn, lost interest in daily activities, and expressed feelings of hopelessness and worthlessness. He's struggling with financial instability and fears related to his immigration status, which have intensified his emotional distress. Concerned about his well-being, his wife called a mobile crisis team after he said that his family might be better off without him. He faces significant barriers to accessing culturally appropriate mental health care and making timely intervention critical. All right, so as we think about Carlos, you are called to respond to to support Carlos, who is currently having a panic attack at home. And his wife contacted you, and because she is very concerned. So as a mobile crisis responder, one of the pieces that we're going to do is you're going to assess Carlos's mental health needs, and also de-escalate the immediate crisis if needed, and begin working with him and his family to identify the long-term support. So what do we know about some of the situations that are influenced by Carlos right now? And the question for you and the invitation is, please share how you think Carlos's fear of deportation might impact his willingness to engage with a crisis responder. What are some pieces that you're kind of thinking about already? Isolation, uprooting, definitely, right? So discussing the immigration piece, the triple trauma, maybe, right? Economic trauma, separation from family. When we're thinking about the isolation, we don't know, we're just kind of making an assumption right now that there's still family in Honduras, right? So the separation and uprooting from country of origin. The resources and work he may have can be ripped away from him at any time, right? So the uncertainty of not knowing those pieces.
Yeah, and I'm also thinking about how he is struggling financially. And so he may be feeling a certain way about maybe not being able to support his family, and being really hard on himself for the financial issues that he's having.
Different cultures, breaking down a sense of wholeness, culture, and family. Yeah, his expectations of the role he plays in the family and not letting his family down. Exactly what Erin just said. Yeah. All right. Well, thank you for connecting to Carlos. And so as we begin our strategies or building our strategies to support Carlos, right? So on the left, these are one of the many, because you are all wonderful responders, but these are one of the many that you're going to incorporate, right? So utilizing reflective listening, active engagement, open-ended questions, right? So one of the pieces that as a crisis responder, it's critical for us to approach Carlos with cultural sensitivity and empathy, right? Start by acknowledging his experience and validating his emotions. Those are the pieces that we're going to start with, right? On the right-hand side, these are some possible questions, right? As you're starting to build that rapport with Carlos, these are some sample questions that you can begin to utilize with Carlos, right? Say things like, Carlos, can I see that you're feeling I can see that you're feeling overwhelmed right now. I'm here to help you. I want to understand that what you're experiencing and how we can work together to help you feel safe. So as you're thinking about some of these strategies, are there any other questions that come to mind? Or how would you build rapport with Carlos, knowing some of the cultural nuances that we're going to be approaching with him? Did something specific make you feel this way? There might have been a trigger, right? One of the pieces I like to do when I introduce myself to someone is, or at least in the beginning parts of it, is I want to start with the strengths in mind already, right? So what are some of the things that have gone well for you since you've arrived? Because we start to have that conversation around supports. So someone in the chat wrote in, I'd expect my EMT on the team to get a set of vitals and ask about health history too. Normalize mental health as part of overall health. Absolutely. Yeah, sounds like you have a lot of weight on your shoulders as you lead your family in this new journey in America. Great validation, Karen. Ask about religious or cultural connections locally. Yes. Right. So somebody wrote in earlier about a trigger, right? That was Patricia, I believe. So we kind of connect back to the challenges that you're facing right now. So there's something that precipitated this, like, or this particular situation right now. So as we move through building rapport, right, we're starting now getting into the assessing the cultural and emotional needs that Carlos may benefit from, right? On the left-hand side, this is one of the many strategies. Somebody already started to think about that, right? How does the role of familismo, faith, and community guide your crisis work with Carlos? Right, somebody already started to say religious connections or cultural connections locally. If they've been able to communicate with family back in this case is Honduras, right? Are they connecting back to their family? Validating that the value of family is really important for Carlos, right? what about maybe perhaps asking if the wife can actually play a role in the recovery or accessing additional support? Because a lot of times individuals we mentioned earlier, they may not want to worry their partners or significant others or their family members. And so starting to have a conversation around engaging maybe the wife, could that be a potential support system for Carlos?
And Angela, I'm even wondering,
Mm-hmm.
do you think Carlos would be more comfortable talking to a man or talking to a woman one-on-one? So do you think the member of the team going out and engaging with him matters?
Yes. Thank you for connecting that. Very, very important.
Mm-hmm.
Mm-hmm. If at all possible, right? If there's a male in the team, that would be very, very important.
Yeah, so then I think that would support in maybe his feeling of like head of household needing to take care of things,
Yes.
and he has someone who can understand that and can relate, and that could help establish rapport and kind of be like, hey, I got it, dude. I understand what you're saying. I understand the pressures that you're under. So just an
Yeah,
idea.
no, I love that idea, because the other piece too is the connection to mental health, right? So it's not a sign of weakness if you're connecting to supports, right? So that would be another great strategy or intervention to utilize to be able to get Carlos to access to support systems. Faith, familismo, and community, right? So we want to learn more about not only just health, as somebody talked about, but also spirituality, faith. Is there another leader in the community that might be able to be an additional support for Carlos?
And depending on when he came to this country, maybe he hasn't found his community yet.
Mhm.
Maybe depending on where he's at, maybe there's not a lot of other people from Honduras that are there. So there could be a lot of other Latinos and being able to communicate, but then like finding his community with the people that may understand more about where he's coming from. So maybe he hasn't had that opportunity to establish a church that he's comfortable,
Yeah,
or
yeah.
the extended family kind of feeling of um other family groups.
Yeah, and because part of it, it could be that can be contributing to the isolation that he's feeling, right? The disconnect. So it's us kind of assessing that information and finding the supports that are available in the community. Somebody wrote in the chat, are there any rituals or traditions that can continue on your new home, right? Depending on how recent his migration is to the US, right? So all of those pieces are really, really important. We're going to move towards now identifying and addressing immediate needs to support Carlos, right? So on the left side, we're going to continue validating Carlos throughout the process, but also what is the bigger issue, and reflecting back, and somebody talked about that earlier, is like, what is that anticipation, or what actually activated, or what created this, what's different right now, right? So what created this piece for Carlos to feel this way? And then also, how do we support that information? So Erin talked about this, if at all possible, having a male connect with Carlos, but if not, that's something that we want to consider, but also asking permission before offering support. Oftentimes we're jumping into the intervention, right? And so if there's a way that we can connect, or are there any other traditions or pieces that also help him to de-escalate or feel more grounded, right? Those are important to acknowledge as well. So as somebody talked about rituals or traditions that can continue. Also asking what has worked in the past whenever he's felt this way, right? And then if using de-escalation strategies of appropriate at this time, right? So as we're looking at this, beginning with by naming and affirming his pain without rushing to fix it is important. We can say things like, Carlos, it makes sense that you're feeling overwhelmed. You've been through so much leaving your country, supporting your family, and facing so much uncertainty here. Recognizing the deeper stressors and the intergenerational impact. Love that question, Karen. What will help you in the most right now? Okay. What strategy? What's done in the past? Oh, go ahead, Erin.
Yeah, no, I was just going to say with Karen's question, it's very person-centered, and it allows him to lead in his healing journey on what is going to work for him. So we're not prescribing him anything.
Yes, absolutely. And also it's just it signals that his story still matters and that you're ready to listen, right? So you're ready, you're connected. If nothing else, Carlos can't think of anything else, we can try simple strategies, right? Body-based experience practices, slow breathing, right? Grounding techniques. That might be something that, Carlos may be open to, and when I just continue asking for permission, right?
Yeah, and this is brought up in an earlier training, and it kind of like surprisingly something I've never thought about before. But if someone is spiritually connected and religious, maybe asking if it would be okay to pray with them, and maybe starting off that way. And again, as Angela said, asking permission, seeing what their comfort level is like, but that might be something that could be soothing and building trust and rapport with someone.
Yeah, so the physical health, thank you, Erin. The physical health, right, continues. Have you been eating regularly lately? What's your favorite comfort food? Right, just connecting back to making sure. So now that's a really great segue, Karen, because now we're getting into some of the, planning for Carlos, right? So as we're moving through the process for supporting and creating this long-term plan, right? The strategies would be like listing some of the cultural appropriate resources, family support, faith support that we're addressing, right? So it's an opportunity for us to guide Carlos towards long-term solutions, right? How do we introduce mental health services that are culturally responsive? Meet where Carlos is at, right? We're going to have to think about having bilingual therapists. Erin mentioned this already, immigrant-specific support groups that could be available in the community. Faith-based counseling, right? There was one phenomenal group that in the community I used to work in, that provided support to Latino dads, and they were all peer-led, right? So if there is something like that in the community, that would be great to connect Carlos to, right? And so we can create that list together. Is there anything else that you can think of, right, that we're addressing? So bilingual mental health counselors, support groups, faith-based agencies, right? There could be immigration rights organizations that provide legal assistance, right? So there might be some additional components that we can support in creating that resource list.
And I think one of, in the last few years, with Zooms being so popular and accessible, so you could even find groups that are Zoom based anywhere. So even if you don't have something local in your community that you can connect him to, maybe doing a little bit of research and seeing if there is like a Latino dad group or something else that would, support Carlos that is Zoom based and that he'd be able to connect with.
Yeah, absolutely. And there's different times, right, that you can actually connect as he works. All right, we're going to transition into safety plan, right? And as we move to supporting, now just a little quick reminder of creating those emergency contacts, any types of coping strategies or any kind of follow-up care that's going to be needed to support, right? And after, one of the pieces that I always think about is how reflecting back on how cultural considerations, some of the systemic barriers and personal strengths influence your approach in working with Carlos, right? So ensuring that Carlos has clear next steps and understands that the help is available. I know this is a lot, Carlos, but you're not alone in this, right? We're going to work together to get through it. There are people who care about you, want to help you. Remind Carlos of the strengths, the values that he brings to the family, to his own work, and utilizing that to help to support to move forward, right? Yeah, asking if there's another individual, right, that's from the same country of origin that could provide some tips or support to navigate, right? It's a great way to make those connections.
A lot of good feedback in the chat. So thank you for all of your participation. Excellent.
Yeah, so when I work with Carlos, it's really just focuses on the importance of cultural sensitivity and our work and how we're going to be connecting and establishing the rapport to build these beautiful outcomes, right? So the immediate de-escalation that's going to happen, it's going to be dependent on how we're kind of showing up in the space as well. And so it's important for us to recognize the intersectionality of Carlos's experience, which is the immigration stress, trauma, mental stigma, and family support. As mobile crisis responders can offer such a holistic and beautiful support approach to that recovery for Carlos. So that's some of the important aspects to think about as well. And so as we wrap up today's session, I want to take a moment some of the key takeaways, right? So like I said, we can build on to extended time to have a discussion about Carlos, but part of the aspects about what we've covered today is the cultural considerations, the strengths, the protective factors that are faced within the Latina community. And these unique challenges really are connected to the work that we do, right? So it's important. One of the most powerful points that we discussed today is the importance of familismo, which is very a family-centered approach. And in a crisis, the family can be a critical support system. And as mobile crisis responders, we have the opportunity to engage families as part of the intervention process, right? Integrating the family and community into our response to engage families as part of that process it's extremely important for that culturally responsive approach to care. And when responding to crisis situations, especially in the work that we do, able to quickly assess the situation, build rapport, and create a culturally appropriate interventions is essential. And as responders, one of the pieces that, the impact that we're going to do is also based on the individual's willingness to seek ongoing support, right? So it's also such a great opportunity for us to just have these acknowledgements and recognition so that we're able to support individuals in this particular community. And the invitation to you today is, all the information that you gained today is like, what's one key action that you're going to implement as you leave today's presentation, the session? What is one action that you're going to implement? And feel free to write that in the chat. And also want to thank you for your time and your commitment to all the work that you do and for spending the last 90 minutes with us. And we're hoping that you have an awesome day. I don't know if I want to kick it back to Erin, but I really want to thank you for your time.
Angela, thank you. Thank you for your expertise for this engaging conversation, much needed, especially as California is largely, hugely, majority Latino populated state. So with that rich culture, it's important for us to know how to engage appropriately and expressing our cultural humility with that population. So thank you for your expertise in joining us. So thank you so much, everyone, for being here. Angela, you're a star. Thank you. I appreciate you.
Thank you, everyone.
And all of you mobile crisis responders out there, as always, you guys are doing amazing work. Thank you for the lives that you save and for everyone who you are supporting out there in the world. It matters and your work matters. So thank you.
Have a great day, everyone.